Hi, it's Dr. Danielle Moore Collins here, Clinical Director of Dermaface MD Skincare and Clinics. A lot of people this week have asked about smoker's lines. So before we discuss smoker lines, which are the lines above the lip, I wanted to point out you can have smoker's lines if you are a smoker. If you never smoked, you can also have smoker's lines. And if you are a person who used to smoke and has since stopped smoking, you can have smoker's lines. So they're the three types of people who can have smoker's lines. So even non-smokers can end up with smoker's lines. I want to talk about the two different types of lines that we get on our face. You can have a static lines or you have dynamic lines. So static lines are lines that are present when our face is resting. So if I'm resting now, I probably have little lines here and here. But if I raise my eyebrows, because I actually need my Botox done, I had Mohs surgery here recently, so I don't want any needles near my face. But if I raise my eyebrows, I have lines. So they're dynamic lines. So again, three types of people for smokers' lines: non-smokers who never smoked, people who are still smoking, and people who are reformed smokers. Then there's two types of lines. Number one, static lines. That's lines that are there when you're resting. And then dynamic lines, which are there when you're moving your face. So this brings me back to smoker's lines. So smoker's lines can be there when you're resting, so that means they're static. They can also, and are actually almost always made worse when you move, so they're dynamic as well. So most people will have just light smoker's lines, and then will have on movement much more pronounced smoker's lines. And again, that's whether you smoke, you used to smoke, or you never smoked. It can just happen, people. So in my case, I just put on some lipstick or lip gloss just to try to show you. Resting, I don't have any, but then if I go like this, I have a few here. So here is the solution. It's a 2-point solution to deal with this. First of all, I don't know if you guys remember the old cowboy western movies. You know when the cowboy runs inside and then he barricades the door? Well, the first thing to do is to have lip filler along the vermilion border, which is where the pink meets the white. And when I'm injecting filler, I normally inject it here. And with a bit of luck, it goes all the way up along one side, and you don't have to do multiple injections, therefore reducing the risk of bruising or hematoma. The second thing is on the other side, go in, and again, hopefully it'll just go up the whole tube. No one injects the Cupid's bow anymore. That's not done. So with a little bit of luck, you'll get lip filler all along the vermilion border with just 2 injections. I tend to be able to get it with 2 injections. If there's scar tissue, you won't. But for the most part, one derma filler injection here, and the product will shoot up either side. That's that barricaded. So you have that locked down. Then regarding the muscles up here, again, these muscles are elevator muscles. So that's why people get gummy smiles, because they're raise up muscles. So what you want to do is have a sprinkling of Botox, almost little zigzaggy. And again, half a unit, half a unit, half a unit, maybe a little quarter unit here, and it's a combination treatment to get rid of smoker's lines.